Good afternoon, everyone. Welcome to the fourth edition of Fireside Chat, which we have been, having as a monthly series. I'm Vadeesh, founder and CEO of AlgoShack. Before we begin this, let me narrate the patient journey. So this is something real, and this is coming from my personal life. This is about 3 years ago. This is about my father. My parents are in their late 80s. Exactly 3 years ago, around July 2023, one fine morning, I received a call from my mother saying my father was unable to get up from the chair. And I thought it was to do with Parkinson's because doctors had suspected Parkinson's earlier. I thought things got aggravated. Anyway, I planned to go there because I could sense some anxiety. And when I reached Mangalore, the first thing that I did was to reach out to my sister-in-law, who is in the medical space. She has done her MSc in nursing, and she knew most of the healthcare professionals in Mangalore area, especially the renowned doctors. And she asked me to take him to a neurologist. I go to a neurologist. Neurologist says, you have to get an MRI scan done. For the MRI scan, I had to go to a diagnostic center. And I was handling this all by myself. I didn't have much support at that moment, on that day. And then I take him to diagnostic center. I get the MRI done. And I go back to the same doctor in the same clinic. And some of these people are in the 5th floor of the building. And it's not easy to access, and not easy to access when there is a patient. And my father's issue was getting aggravated by the hour. I didn't know. Later on, the doctor identifies it. He identified it to be stroke, and he asked us to get him admitted in another hospital. So I had to take him to another hospital, and then I had to coordinate with the resident physician there. The same neurologist that I first went to, and with the resident physician and some more doctors, it needed a lot more coordination. Things went smooth, from the doctor to the diagnostics center to back to doctor. But for that coordination, everyone did their job very, very well. And finally, they said, this is about 3 days of medicine. That is the protocol. With every passing day, my father would lose strength. And they told me that it was expected. And he would lose all his strength, would not be able to walk at all. And then slowly he would come back to whatever normal or subnormal levels. He recovered from that stroke. But the point is, it calls for so much of coordination between specialties and doctors and systems and so on. And that is the theme. Building a better healthcare ecosystem, combining process technology, and to help with patient outcomes. I think that is the theme for the day. And this is an important topic for AlgoShack because we have been in this space in testing, in quality engineering of complex systems in the healthcare space. So this is very important topic for us. The aim today is to go beyond making any headlines. We really want to have a practical conversation on how healthcare organizations can make processes, technology, leadership, and engineering excellence work together in a way that improves care delivery and patient outcomes. With me, I have three eminent personalities from the industry. They bring significant experience in healthcare transformation, clinical systems, software engineering, and product development. Let me start with the introduction of panelists that we have today. With us, we have Hareesha Prabhu. Welcome, Harish.
Thank you.
Harish is an accomplished R&D leader with close to 3 decades of experience in the industry. He started off as a software developer with Aris Global and then moved on to Motorola to work on the world's first camera integration into a mobile phone, and then joined Philips in 2003. And since then, he has been with Philips. He has played various roles in Philips in his long tenure across various product portfolios: DVD players, remote controls, connected digital products, and healthcare, and in various capacity like software developer, QA engineer, project program manager, department manager, global R&D leader, and so on. He is currently working as head of strategy for the Philips Innovation Campus in Bangalore, and is responsible for identifying opportunities to make the organization future-proof across technology, domain, AI, execution excellence, and people culture. He is also actively involved in engaging customers in close coordination with the India Commercial Organization to unlock the immense potential that India holds in the care delivery. Welcome once again.
Thanks, Vadeesh.
We have with us Vinaya L S. Vinaya L S is a technology and digital transformation leader. Welcome, Vinaya.
Thanks, Vadeesh.
She drives the adoption of generative AI in large-scale system development. She focuses on transforming R&D engineering workflows, improving productivity, and accelerating time to market, enabling innovation at scale. With over 20 years of experience across healthcare, consumer products, oil and gas, and transportation, she has led global engineering, software, and product development teams at Philips, Diageo, and General Electric. Her experience spans building and scaling high-performing teams, delivering complex product and platform solutions, and driving digital transformation initiatives across global markets. She currently leads large-scale system development and automation programs, building global centers of excellence that enhance system integration, strengthen engineering productivity, and improve delivery efficiency through advanced automation and AI-enabled platforms. Throughout her career, Vinaya has driven enterprise-wide transformations, advancing agile and DevOps adoption, standardizing global development practices, and leading end-to-end product and software development life cycles. She has built and nurtured high-performing teams across Europe, US, and India. Her current focus is on using generative AI to reimagine the engineering lifecycle, bringing a practical, execution-driven approach to scaling AI responsibly and delivering measurable impact across R&D and engineering ecosystems. Thank you for joining us, Vinaya. Welcome. We have with us Jessy Kurien. Jessy, welcome. Jessy Kurien is Executive Director of Engineering at Athena Health, where she leads the R&D experience focused on transforming developer productivity and experience at enterprise scale. Her work spans developer experience, DevSecOps, platform engineering, agentic software development, and the large-scale rollout of AI and SDLC tools that help thousands of engineers build, secure, test, and deliver software more effectively. With more than 26 years of engineering leadership experience, Jessy has led major modernization and transformation initiatives across healthcare and industrial software organizations, including leadership roles at GE Healthcare and GE Oil and Gas. At Athena Health, she is driving next generation engineering platforms, AI enabled developer workflows, secure software supply chains, and agentic SDLC practices that reduce friction, accelerate delivery, and improve software quality across the enterprise. Welcome, Jessy.
Thanks.
Together, these perspectives allow us to look at healthcare transformation from strategy, engineering, reliability, product development, and real world adoption. Let us begin with the patient experience itself. So, the first question is that the systems are disconnected. There are departments in hospitals, there are specialties. Whereas from a patient perspective, seamless care delivery is what one would expect. Keeping this in mind, if you were to redesigning healthcare from the patient's point of view, what would you change? Harish. Yeah.
Okay, I can go first. I think the question reminds me of Munnabai MBBS, right? So, form bharna zaruri hai kya? That's how Sanjay Dutt goes in that hospital, right? So, we have come a long way from there, right? So today, who would have imagined that a regular blood sample for which I used to fast and go to some diagnostic center early in the morning, have breakfast somewhere, after 1.5 hours go and give the blood sample again. Today it comes home.
Yeah.
Right. Similarly, there is a lot of development when it comes to preventive care. Right. In Bangalore, for example, I can take names of a couple of places. So there is a company called Neura in Indiranagar.
Yeah.
There is a company called Scent in Koramangala, where the entire experience of preventive care is very different from the traditional way we used to give our blood samples and get an MRI done, get an X-ray done, get a CT done, right? So today when you go there, it is like, a nice visiting room where somebody approaches you with the tab in the hand.
Yeah.
And in 1 hour, you are done with the whole process and then you go home and get the report on your WhatsApp.
Yeah.
But when it comes to healthcare, so it is little more different, right? Because the room for error is almost zero there.
Yes.
So it is a matter of life or death, right? So I'm not saying that it will not happen, but care will come home at some point in time. So today we go where the care is, but at some point in time, the amount of progress and the developments that are happening will ensure that the care will come home.
Yeah.
All of us are so used to so much of digital technology, so much of wearables. Our phone has become our digital twin, more or less, right? So with that kind of data that is percolating, at some point in time, it will come. But for all good reasons, the adoption in the healthcare industry takes time. It is not because there is no willingness. It is because it is like, you are trying to put your hands into a running engine.
Yes.
Right? How many of us really want to do that?
Yeah.
Versus fixing something that is greenfield, right? If it is a greenfield project, which means I have a piece of land, I have ample money, I want to build a hospital. There is a lot that I can do from day one, bringing in the digital experience. Maybe I can go to the extent of saying, you come, you show your biometrics, Aadhaar, and then rest of the things are taken care. You are not there yet. So systems are desperate, that is true, but they're also getting connected one at a time.
Things are changing.
Things are changing.
At some point in time, care would be delivered at the, wherever you are.
Exactly.
Wherever the need is. That's happening. I mean, I agree. I mean, Vinaya, you want to chime in?
Yeah, I think Harish covered the examples of how the Neura and Scent kind of a things. I just experienced personally last week when I went for preventive health checkup. The entrance, it didn't feel like a hospital. Typically, the moment you go into a hospital, you feel that a lot of patients around, or you also feel like would I catch any infection or anything. It's like you are visiting a hotel, a very clean environment. You step in there. But if you also, to your question on how would I redesign, I think alongside the patient journey, probably we need to reorganize ourselves more in terms of how the patient journey happens. Taking your own example, you said, right? You went to diagnostics, then you had to consult a doctor, then you had to visit the specialist to look at. every place we go today is disconnected systems.
Yes.
I think diagnostics have a different system, the hospital has a different system, and the pharmaceutical will have a different system. Imagine a world where a patient enters and it's like you scan a code and you need not repeat your information every time. In diagnostics, you need to say, into a physician, you need to say, in pharmaceutical, you need to say. And especially in a case of stroke, every second matters.
Yes.
If you were able to save those hours, right? If everything is connected, I think technology is there around in a scattered manner, but it needs to be connected and work as a seamless solution. I think that's how probably we need to start redesigning our existing solutions around it.
Yeah. Thank you. No, things are changing.
Yeah.
They are improving, but I think it also takes time because it's a running engine and you can't fix it all in one go, probably one at a time.
True.
I agree. What would you say, Jessy?
Yeah, I think to add on, as Harish mentioned, one is the future is looking brighter, where change is happening, care is coming closer home, and the user journeys are very important. Now, in an India context, I think taking it to the masses is also important, and to have the aspect of the social deterministic factors that contribute to making healthcare affordable, accessible. For all. I think most of the domains we have a lot of hyper-personalization, and I wish, if you, again, back to your question on redesign, if I had a magic wand, it's like, can we provide that from a patient experience standpoint, especially with the background that the patient is in distress, the patient is, and probably the environment around is not the most conducive in terms of, it could be language, it could be accessibility. So how could we bring in a way where from visit to visit, the patient is able to follow the care, to also get to a treatment, outcomes that are more successful, and design solutions where the patient has a lot more control of the outcomes, the data, the progress, and insights and data through that journey as well.
Yeah, and even awareness could improve.
Awareness,
if accessibility has to be addressed, then awareness should also improve.
Yeah.
We wouldn't know the symptoms, for example, of different issues.
Absolutely.
As it happened in the case that I narrated.
Yeah.
I didn't know that it could be stroke. I thought it was, based on the description I received, that it was probably an aggravated case of Parkinson's. And even when I took my father to a doctor, even when he asked me to have an MRI scan done, I didn't know that even if it was a stroke, it needed only 3 days of medication, and that is the protocol. Worries take over, and then anxieties build, and decisions are impacted because of the emotional involvement. Thank you. So
it is not very far off, right? So just to illustrate that, we are not talking fiction here, because a couple of years ago, Philips already demonstrated that an MRI can be put on the back of a truck.
Yes.
Right. So we always imagine that MRI is, an elephant in the room.
Yes.
But we have gone far away from there. Right. So today, an MRI, not in Bangalore, of course, but there are places where it can go to where the care is needed.
No, and US is probably much ahead of the game, and they are talking about, making it all available at the point of need. Accessibility and affordability, both they are talking about. I think it's a matter of time before India also gets there. And I think you rightly said, for the kind of population that we have, if we can really cater to it from a social responsibility perspective, I think nothing like it. Even what I talked about, probably it was available to some of the privileged and probably not everyone. So moving on to next question. I think, as we always say, it all needs that kind of vision, making care available at the point of need, making it accessible, making it affordable. So how do those vision statements get transformed into real actions on the ground. What do you think are the gaps in converting strategy into an actionable plan? I mean, what is your take, Harish?
So-
What are the key gaps? I mean, where do we generally fail? What are the pitfalls?
So the biggest, I lead the strategy for the organization, right? So the biggest pitfall that I see is that the person who defines the strategy defines it and moves on. The people who execute it are another set of people, right? I'm not trying to fix a blame on one or the other, but that is where there is a slip between the cup and the lip, right? So I would rather look at the person who has defined the strategy, stay put with it till the last decimal of the execution, right? It is not about having a fancy statement or a PowerPoint and then trying to push it down the throat before you really make everybody understand and accept what you're trying to do. So change management is extremely important, right? So many times that is where we falter. The second is right incentivization. I'm not saying that when I say incentivization, it is not the monetary part that I'm talking about, right? Incentivization, what I mean is, what is in it for me to go through this change management process, right? So that has to be very, very clearly articulated, because that is not the same for every person who is involved. For different people, a change means different things. So how effectively have I articulated the whole thing? And the most important part is, have I factored in the amount of time that is needed? Many a times we are so restless that, okay, I defined it, here what it is, I want to see it tomorrow. It doesn't happen, right? It takes time. So, I mean, culture takes its own sweet time to change, right? So strategy is also very similar. So you may want to do something at a very aggressive pace, but if you follow these three, four things, I think it will fall into place.
Yeah, there has to be continuity.
There has to be continuity. There has to be a follow through, and it cannot be done by some random person.
Yes.
So person has to take the ownership, define the change management, incentivize the right people for the right reason, and then follow through.
Yeah. So can you chime in, Jessy? What is your take?
Yeah, my take is, especially for a domain like healthcare, there is an ecosystem outlook and an organization outlook. So many a times the strategy has challenges when you look at the boundaries of the organization and the boundaries of partnership, and that partnership may extend to from the patient. While the center is the patient, there's the physician ecosystem, the hospital ecosystem, the care management ecosystem, the insurance ecosystem, the labs, and pharmacies, and they are all interconnected. So it's hard to kind of really look at a solution unless you're also looking at the network effect, the ecosystem effect that is required, and not just look at it as a technology of interoperable systems that will magically work. So I think in that strategy, to really keep the current workflows, the current processes, and the to-be transition state, not just looking at it as a technology transformation, but really the people, process, technology together is an important part of the strategy.
Yeah. I think people may look at it as a technology issue, and these days they attribute everything to AI and hope that AI will solve all problems. I think that resonates.
Yeah, systems talk, but if organizations don't talk, if people don't talk, the process still fails, right? So it's
Absolutely.
important to
Yeah, sure. So, Vinay, would you like to add that?
Yeah, I think I don't feel technology is a gap in the healthcare industry. I mean, we have technology solutions, beautiful solutions, but I think the problem is in the adoption. We digitize things without looking at the adoption, or what I mean is our interconnected workflows, right? Let's take, for example, telemedicine existed even before COVID.
Absolutely.
How many of us used to use it? The feeling of an end user was you have to go to a doctor will have to see you in person, test you, then only you are confident about the telemedicine.
Yes.
But after COVID, now I think you are up for it, right? You book online appointments, although still it's not very famous after I mean, it's still growing, but it's a possibility. There is a remote collaboration, remote connecting to the doctor. Of course, at the same time, because this is healthcare and every decision is related to the patient health, you cannot take it light. There needs to be a solid governance around it, especially also mass country like India, right? We need a lot more governance because the population is huge. It cannot be just because a technology is there, it is available. You cannot start all digital apps and go and take your self-care. One of the things when I was pregnant, the doctor, gynecologist first told me is, I know you're an engineer, please don't Google anything. Ask me questions.
Yeah.
I think that's kind of a thing, right? We have now source of information and we assume our own stuff. But without right governance and redesigning our technology and around the workflows, how it will benefit clinician, I think that's the major gap I see.
Yeah. Thank you. I think the basic habits also come in the way. To use, for example, telemedicine.
Yep.
Those who used it immediately after COVID, they might not want to use it again. I mean, they may want to go back to the doctor and get that first-hand feel.
Yeah.
But in the process, the system is getting burdened.
Yes.
So, yeah, I think there has to be an overall change for it to get better, I think, in countries like India especially.
And technology is not the answer for everything, right? So
absolutely.
It is a classic case of when I have a hammer in my hand, everything else looks like a nail.
Yes.
Right? So, but then it is also a fact that a fool with the tool in his hand is still a fool.
Yes.
So you have to be extremely cautious where you want to use, what you want to use, and how you want to use.
Absolutely. Yeah, absolutely. Couldn't agree more. So I have something very specific for you, Harish. So you have worked across technology, strategy, healthcare transformation over many years. What has shaped the way you think about change? I mean,
so one fundamental difference that I see in myself is that in my younger days, I used to look everything from an engineer's lens. So if I do this, how will it benefit the patient? How will it benefit the customer? How will it benefit the business? So that is a significant change in the way I look at things, right? So I don't want to do something because I enjoy doing it. I would rather do it to justify what is the value that I'm creating, what is the impact that I'm creating on either a patient or a customer or a business.
Yeah. So centered around patients and probably care teams.
Exactly.
In that process.
Yeah.
Because those are the users or the key customers at the end of the day. And not about how well we have designed it.
Yes.
How, whether it fits the purpose or not.
Exactly.
Sure. Thank you. I mean, I think many of us would have gone through that transition. Some of us would think about design when we think of a product.
Yeah.
And we would be excited about the design, what technologies we would use to design, and things like that, but without really checking what the end user really wants in that solution, what his or her needs are.
Yeah.
Thank you. That's quite helpful, Harish. I'll move on to the next one. This is a common one. So, in order to gain the acceptance by the care delivery teams, so what one has to do? Let's say a solution needs to be accepted by the hospital or by the care delivery team. What one has to do to meet that requirement from your perspective? For example, knowing very little that you do, you deal with, for example, cath lab. So in order to gain the acceptance by the clinicians, what do you do as part of that journey?
I think predominantly what anybody would look for, right? I mean, even for us as a user, if you're buying anything, what you would look for. So for clinicians, it's a lot more reliability. Is the system reliable? I mean, how can I even, let's say in any severe conditions, would still the system works? What will happen to the patient? If we are able to demonstrate reliability, if we are able to demonstrate predictability, constant and consistency, predictability and consistency, and the responsiveness, all these three factors are very important for them, right? It's not like in a banking application. Let's assume I'm doing a money transfer, could be any huge amount. I can be patient and waiting in front of the system for the server to load, the page to refresh, waiting for my payment gateway to pass. As a clinician, I will not be able to do that. For me, every second matters. If during interventional cardiology, if you are on the performing a procedure, every second matters. Your frames cannot take ages for refreshing. Your seconds you would have missed identifying a clot. You would have missed identifying a region of interest if my frame speed is very low. So I think the responsiveness, reliability, how reliable, because again, the examples of India, outside India market, right? India, we per day procedures probably in some super busy hospitals are 7 to 8, sometimes goes up to 10, depending on the kind of regions. Whereas probably in US, Europe, it could be 3 to 4 procedures or max like a 5 procedure per day. So the market needs are different. The requirements are different. The governance is different, and the usage is different. So, but the factors of reliability, predictiveness, and responsiveness, I think, is very key. If organizations are able to prove that, I think that gains a lot of trust for the industry and clinicians to accept the solutions.
Yeah, so sure. I think you talked about reliability and trust. I think I would underscore trust. Absolutely. Finally, if only they trust it, would they use it?
Yeah.
Not otherwise, especially in the healthcare context. Thank you. Jessy, do you want to chime in there and add your perspective?
Yeah, I think one, I mean, again, underscoring the trust part of it, the trust established and trust continued. And especially if it's a new solution, how you drive that change is more different than an existing solution. Back to your AI example, most of the physicians hate it, and change is hard, change is difficult, and largely it goes to trust, right? How do I trust the system which is giving me point-in-care clinical decision support systems, and how can I really look at relying on an input? And at the same time, the technology is coming at a pace where you can't ignore it either. So interestingly, we are at a cusp of a phase where change is a lot beyond the control in every domain, in every technology, every landscape. And we're going through that fiction of what a new solution should mean and what trust should mean. Trust is getting eroded because fundamentally many of the AI LLM models are non-deterministic, or it's very hard to give high confidence. So I do think healthcare is more challenging to kind of use solutions which are non-deterministic. So unless you're able to bring deterministic solutions and establish trust, it's hard to continue to earn that trust.
Do you see any difference between solutions that care delivery teams use versus solutions that patients use? I mean, in gaining that trust, do you see any difference?
There is difference. Actually, clinicians would be far more accountable on the data in terms of the quality of care because they are really using it from a decision-making standpoint. And from a patient, it is more, I want insights and input on the treatment that I'm going through. I want a second opinion. I want to make sure all my data is I have access to all my data. I have understanding of the procedure that I'm going through, and I have awareness of what it will cost. And so from a patient standpoint, it is like, am I being treated, is my treatment right? And I know what it costs, and I know I will come out of this well, is the primary thread. And from a physician standpoint, hey, I can't afford to make a single mistake. I just cannot, try this new, cool thing if I'm really not confident that the solution will work.
Yeah, thank you. Harish,
I think recently I read a news article where, somebody got richer by 700 crores on a Friday evening, right? That was apparently a technical glitch, which they reverted on a Monday morning. For 2 days, he was owner of 100 plus crores, right?
Yes.
We can't afford to do that,
Yeah.
right? So, what is extremely important, in addition to what both of them said, is I can never say that my system will work. It will work, but even if I give you a 6 sigma level of quality, there is still a 0.0001% of some failure. What is important is to be capable of identifying that failure and having a fail-safe mechanism, right? So that is for, just alluding to what Jessy just mentioned about building trust, right? So I'm transparent enough to say that there is still a 0.0001% of failure, but if that happens, these are the fail-safe mechanisms that I have.
This is somewhere we can't take any chance.
Yeah.
Right? Absolutely.
Yeah. So that's what I always keep telling everybody, right? So the work that you are doing today, there is no way I can take it light, because tomorrow the person who is going to experience that could be my family, my parent, my spouse, my child, or my friend.
Yeah.
So there is no compromise that I want to do when it comes to them. So why would you do that?
Right? Zero tolerance zone, right? So absolutely. So this question for you, Vinaya, and if there is anything that you can share based on your past experience, not necessarily your current experience, what are your principles that you rely on when you have to make a decision between speed and quality? Answers may be obvious, but we want to understand what experiences shaped your decision-making process.
I'll give you an example, not quoting what exactly, but from the different industries. I had worked before in General Electric, in transportation, aviation, kind of a word, oil and gas, where every single new product introduction takes about 8 to 10 years. Any new engine, any new locomotive, it's not a matter of 6 months or 1 year. Worked in that. Then I moved to Diageo, a fast-paced consumer product industry. There, the transitions or the movement is like 6 months. You are on a Black Friday sale. If your system is not up, you throw it to the trash. And it's not like I can move 1 month ahead, 1 more month. So you change your technology so fast. And coming back to Philips, where again you are dealing with healthcare, kind of a regulated industry. Most of the my background has been regulated, whether transportation or aviation or the healthcare. Much and much more regulated it comes to. So the more and more regulated it is, I think the more and more you understand the need of speed. Speed and quality are often seen as opposite, but in the regulatory industry, it is not. Speed and quality have to go hand in hand. Imagine, the world was not ready for a pandemic like COVID. If innovation is not faster, then we will not be able to face another pandemic kind of a situation, right? So the speed is very much important, but at the same time, you cannot let go of quality. We do not look at quality and speed as two different elements. But in the journey, I think the whole, with AI also coming in, AI can speed in multiple ways. But at the same time, we know AI is not perfect. Even humans are not perfect. Even AI is not perfect. But how do you chime in together? How do you build them on top of each other, which gives you a solution where you can still think there is a human in loop for ultimate decision making? All that AI now provides is more of enables you to make faster decision. But at the end of the day, the decision is with you as a human, as a clinician, as a person to take decisions. I think that's the different journey I've seen, and I see speed and quality has to go hand in hand. It can never be running in different directions.
Yeah, but I think it's a very, very interesting perspective. Probably one would expect tilt towards quality as opposed to speed. But I think you gave the right example. During COVID time, if people took years to, come up with the vaccines, things would have been very, very different today. Yeah, absolutely. I think thank you for bringing in that perspective. And I agree. I think accountability doesn't go away, AI or no AI.
Yeah.
I think people who deliver care, they could use AI as a tool, but ultimately it is their decision.
True.
Whatever that it is, and accountability still lies with them. Thank you, Vinaya. I want to move on to next question. I mean, this is more about how we measure. Typically, what happens is, we have seen this. People talk about product. People talk about adoption of the product. People talk about number of users. This happened with EMR, EHR that I was engaged with at one point in time. We were developing Lorenzo for NHS. And we would always talk about how many clinical users have been onboarded, how many administrative users have been onboarded. But that is nothing to do with patient safety or patient outcomes or clinical outcomes. How do you see this measurement happening today, and how would that transform as days go by, as the systems mature further? Harish, I mean, what is your take?
I think there is a definite need to look at our metrics, right? So when I say our metrics, the metrics that are being used, like in a setting that you just mentioned, right? It is no more about is my system working, right? Or how many patients am I actually treating, and those kind of things. It is about what is my mortality rate in a hospital? How many readmissions am I getting? What is the staff burnout, right? What is the satisfaction rate of a clinician when he is using this solution? The metrics have to be more in terms of the end user experience rather than the system output.
Yeah.
Right. So system output is much more easier and can be automated versus how a patient or a nurse or a clinician actually experiences the system. So that shift has to happen. I think it is happening, right? So we are more moving into that direction where we are more quoting, the examples in this space rather than talking about the scan time and how many patients did I treat and those kind of things.
Yeah,
right.
Yeah. You see that change happening.
It is happening. It is definitely happening.
Probably when engineering teams also
understand
that, I think
end user environment,
things would change.
Yeah, things would change much further. Yeah.
Thank you. So, Jessy, anything that you would like to add?
Outcome metrics are becoming more and more important. And in the engineering terminology, you would say that, hey, we're doing clinical documentation processing and making it easier to process the document. But at the end of the day, is it reducing the outcast for a physician? Is it reducing the physician burnout? I mean, that's the success metric to that capability. Similarly, from a patient experience standpoint, are there better patient outcomes? So these are more difficult metrics to measure. In comparison to a claim transaction, it is much more difficult to measure a patient experience, outcome. And because they're difficult to measure, you kind of you default to the pseudo metrics. Yes. But then the pseudo metrics is a trap. You get stuck there with the pseudo metrics, and the real metrics is never kind of get surfaced. So I do think the shift is important, and it is difficult because some of the things that are really valuable are also difficult to measure.
Yeah, difficult to. So that happens with even things like, for example, return on investment.
Yeah.
Now, unless you partner, unless both the parties come together, in this case, those who develop systems and those who actually deliver care, if they don't come together to have those metrics, maybe very difficult. You may define, but you may not get enough data to track
it.
Yeah. So Vinay, what would you say?
I think they both covered pretty well. Probably talking about one of the metrics, let's say burnout of physicians, is so important. It's a example. Last week I was speaking to a friend of mine in Germany. We typically say in India we are still backward in terms of reaching patient care, but I feel no, actually we are much ahead. every class of citizen has access to care. Of course, probably at different levels and reaches might be different. But the whole thing is about it's in Germany. I mean, he met with an accident. He went to a doctor. He had a hairline fracture, so it was not immediately treated. He got an appointment after 2 months. Sorry, 2 weeks. So imagine in India, if a hairline fracture, you just go get admitted, done, everything is around it.
Yes.
And now, okay, after 2 weeks, he got it operated, done. Now they have to claim the insurance process. But they need documentation from the doctor while performing the surgery. Doctor will be giving some instructions and all that they need to take back to the insurance to claim the amount, the whole procedure. The problem is around now, the doctor is so busy. Doctor has given an appointment after 1 month to provide the documentation. So all of your metrics is around not just you don't have the technology to operate. You don't have you have the technology to create documentation, but the doctor does not have time to create documentation.
Yes.
So I think that's where the metrics also, I think, should be around doctors, around patients, and how does it evolve? It's not a constant metrics. I think we are used to, in industries, I think a lot of standard KPIs would be over years.
Yes.
I think it's time for us to keep on reflecting every year on year or time to look at, are we really measuring the right metrics in place? I think that's the first check we need to do.
Absolutely. And as the maturity improves also, metrics would change.
Yeah.
Yes.
So what was relevant at one point in time would no longer be relevant.
Yeah.
True.
Yeah. I mean, if doctor needs 1 more week to, in spite of having everything in place, to provide that document to the insurance company, then I mean, the amount of persuading that is required by the various participants to help with the data, to help with the process of tracking metrics, I think that's humongous. Only when you allow for things like this, I think, would things change. Yes, thank you. So I have one thing specific for you, Jessy. Where do you see platform engineering and AI adding the most value in healthcare product development lifecycle? Where should human judgment remain firmly in control? I mean, we talked about trust, but I think and accountability. If you could go beyond that.
Yeah, so maybe just kind of also reflection from at Athena Health. One of our core philosophy is let doctors be doctors. So help doctors to maximize their time with patient care. And from a platform engineering, our focus is more on let developers be focusing on healthcare software. So to enable the underlying kind of platform so that the overall cognitive load for the developer is much lesser for large enterprise scale software, be it with respect to, so we do have like billions of, API calls and large, petabytes of data that we store in AWS, and the technology needs to scale for high uptime and availability and reliability. So that does require platform engineering in a way where you can build that trust with uptime, resilience, in the solution. So part of the job from a platform engineering standpoint is to make sure that that entire ecosystem from a pipeline to test automation through security, when the code is getting checked in, a developer knows that the safety nets are there in place. It's hard for me to make mistake for a software where trust is important. So that's one of the core goals from a platform engineering standpoint, to make sure developers can build enterprise scale, secure, high quality software with these. Now the AI angle, I would say, so there's two aspects to it. One is how do you use AI for your internal software developer productivity, and a lot of that is also the bespoke kind of SDLC tooling ecosystem that we use from SonarQube for code quality to kind of developer portals and ecosystems where we can see what services are in which environment and what's running in production. And so a lot of that ecosystem of tools also need to be there in place for the human judgment to come in place. So end of the day, the developer will need to kind of look at where the code that goes into production is the accountability of the engineer, and how you enable, I would say, more routine tasks to be automated, and that could be, say, a Java upgrade or a React JS upgrade. So how do you enable the developer's life to be easier in what AI is good at, but at the same time ensure that the application engineers are kind of really laser focused on where the human intervention is required. So what we are really looking at is more from an overall SDLC standpoint, how this fits in and how this change and transformation can help us build better software for our end users.
Ultimately, developers are held accountable.
Absolutely.
I think that is the point. And I want to ask one question. I mean, you are in this profession. I mean, I always had this in mind to ask. You have been in this. All three of you have been in this industry, vertical healthcare, for long. And you also, Vinaya, you were into other verticals, and including what we call retail or digital commerce, and moved on to healthcare, and at one point in time into locomotives where things would take years, and then probably in retail where things change in minutes, and probably in healthcare, highly regulated. Do you relate what you do today to what you dreamt of when you were from your childhood? Is there anything that you relate? What gives you the satisfaction or the motivation to do what you do? I mean, we all understand that healthcare professionals are next to only doctors, and like teachers, this is a noble profession, and one way or the other you help save millions and millions of lives. But is there anything that you are able to relate to what you wanted to do when you were much younger, and what you do today?
Definitely. I think one, the job satisfaction, what they say, is super important for you, right? I mean, in my 20 plus years of career, I think I've been in General Electric and consumer products and back to Philips kind of industry. Consumer products was really exciting. I learned a lot of technology around it. I mean, I worked there for 3 years. I got exposure to data was a buzzword at that time. We got into data, we got into robotics, we got into changing technologies, every new rollout of Windows, every new version of mobiles, everything. I mean, basically the access to technology, the learning was super fast. But at the end of the day, it was something more you are enabling, sitting behind the screen. You are not, your end product is not what you directly deal with customers. I think the job satisfaction for me comes, especially now. We also do hospital visits, part of our understanding of the work, to go and understand really how your products are being used. And part of Philips, when I visited a hospital to understand how it's being used, there was it was a very critical patient which was got into the cath lab, and there was a procedure which was done, and the doctor came out and mentioned, hey, it is because of your system the patient was saved. I mean, that really gives you a super happy feeling of, wow, that's really the satisfaction you get in the job, right? When you really see what you did is really saving a life. And also, especially in the areas of where I work, my team works at a system level. We bring everything together. I mean, hardware, software, everything together. We connect end to end. I feel we are like those tailors who need to stitch everything, right? You stitch the arms, you stitch the pockets, everything needs to be in right place and make sure it works well. So when you see that the person who is using it and you are able to save a patient's life, and it is because of a piece of work which you have done. There are thousands of people, lakhs of people working towards it, but you contributed to it. That gives a different kind of a job satisfaction than really anything. I think this, at this point of time, that was the best job satisfaction I had till date. Of course, it excites you when you see a GE airplane. First, when we were traveling, we were like figuring out, oh, which engine is it? Is it a GE engine? And we say, oh, now we are safe because we know we have the process.
Yeah.
And now when you go to hospital, I look forward for, oh, which Philips machines are there?
Yeah.
And we ask, oh, whether it's a Philips MRI, whether it's a Philips CT, what cath lab is it? So that's, I think, that levels are different. Whatever job you're in, I think job satisfaction is super important. And also for me, from childhood, I've been like, I need to enjoy what I do, and I need to, I love challenges. I need to enjoy what I do. I think that's what is driving me, and that's what I'm getting also correctly. That has been a philosophy. Love what you do, and you challenge yourself to push the boundaries. I think it has been shaping up pretty well in that direction.
Thank you. That was very helpful. I mean, if you can really get that kind of feedback for what you build, real time from a doctor, from a user, I think nothing like it. And especially in the healthcare context, that if it helped save a life, nothing like it, I think. So I can definitely understand.
Of course, everything is not a funky glory. Everything will not be nice. There will also be some quite
challenges,
critical feedbacks and all of that, right?
Yes.
But even one out of this, if you're able to do it, that's, I think, what matters apart. I mean, there can be different things. Nothing is perfect. I think one of them mentioned, there is nothing. There is always an error of 0.001, whatever you do. There's nothing like called perfect in the world. What we assume perfect, I think definition of perfection is with us.
Yes.
I think that's what it means.
Yeah. Thank you. Thanks. Do you want to relate anything back from your childhood days to what you do today?
I think there are different answers to your question if you had asked me at different phases of my life. Right? So if you had asked me this question when I was in, say, 6th, 7th or so, I would have said, I want to be a bus driver. Right? Because I was learning cycling then. Bus was big. Right? But today, when I completed my engineering, I was much closer to hardware. I wanted to be an embedded programmer. Right? But today, if I look back, one thing that has always stayed with me is discipline and doing the right things in the right way. It can be as simple as folding your clothes after it is dried. Right? So when you asked the earlier question to Vinaya about quality versus speed, for me, that is not a question, because quality should be embedded in everything that you do, including how you leave your footwear when you enter your home. Right? It is not just you just throw and then just walk in. So it starts from there to all the way to what you do on your daily basis. Right? So if I look back today, yes, it gives me immense satisfaction, because the kind of work that I'm doing is actually making an impact which I can feel, which I can see, which I can relate to. Right? Because it is so personal. It's not that when I was in TV or a DVD, I did not enjoy it. But it was a different kind of fun, right? Because when you go to somebody's house and see that, oh, that's a Philips TV, then you feel a sense of pride. Versus today, somebody saying, hey, I went for an MRI scan and I saw a Philips machine. And I came back much faster. Right? So that...
it's a different kind of gratification, right?
Yes.
I mean, yes. That's where, we also tell our employees, if you're working on a healthcare project, you're blessed, because in the process, you're doing something very noble. Yes, you're not a doctor, not a teacher, but what you do impacts lives. And this has been the line taken by, I think, GE Healthcare, someone who said, we save millions and millions of lives. I think it was from GE, I think. So your perspectives...
from my perspective, from childhood, solving tough problems has always been of interest. And my first job was at GE Oil and Gas. Had exposure more to the large gas turbines and machines in that world. And interestingly, 6 months before the machine is down, you get to know about it. In an era where there was no AI, just physics, vibration analysis, whereby you can, plan the downtime for a machine. So the huge contrast when I shifted to healthcare is, hey, by the way, healthcare is difficult. It's difficult to have planned downtime. It is difficult to know about, human health conditions have a lot of systemic complexity, which is different from machineries, which also have diagnostic, healing, but the healing process in human is very different. So a lot of, I would say, the healthcare journey has been more with the curing the complexity, I would say. How do you, moving fast is difficult in healthcare, again, because you need to move at the speed with quality, move at the speed with trust.
Yeah.
So that's been the second phase, I would say. So I still do wish the human diagnostics would be as mature as the maturity diagnostics, but I think it's still there.
Yeah. You have also been a process champion,
Yeah.
knowing what I know. So how is that playing out in what you do today?
I think it's definitely keeping a view of, giving me a view of process first, because a lot of complexity that is there is primarily because at the end of the day, it matters, how your job, how work gets done, right, in any place. And if you don't start with that to understand, most solutions, fall apart. And there could be constraints that are assumed, that constraints that are real, bottlenecks and challenges which we don't see when we build solution. So the process angle is more about how do you drive that continuous improvement? How do you keep that system view of the solution rather than the piece of the puzzle in it? So I also see that the processes have evolved a lot, over the years as well, and fundamentally, few things. I would say every company has given a bit of that, from Six Sigma to to Agile, and it also changes how you do things on a day-to-day basis. As Harish was sharing an example, hey, if you do this at work, you do this at home, and
Yes.
it is real. It kind of really changes who we are over time.
Yeah. Imagine we meet again in 2030. What would be the clearest evidence that you would look for? So having built a better healthcare ecosystem, if we were to meet in another 4 years from now.
Quite a list of things. I think one definitely is a connected healthcare end-to-end solutions. Like today, even if you go to a well-established, not taking the chain of hospital name, any chain of hospitals, major one, right? You still go, you visit a physician, then they prescribe something, you go to pharmacy, it's in different floor, buy injection from them, and come back to a section where the injections are provided. So it's like all multiple levels. I mean, I would like a seamless way when you enter. Automatically, I would love if the pharmacist has the medicines ready, directly walk into the injection department to get it done. So that's one connectivity which could be solved.
Yeah.
And also what I like is imagine today if your insurance is due, whether a car insurance or a health insurance, the number of reminders and the phone calls and the messages you get is like enormous, right? What we look at post-patient care, how to keep them connected. Now there are a lot of solutions. We have smart watches, smart rings. It tells you, hey, you have not drank water, get up and drink water, blink your eyes, stand up, take few steps.
Yeah.
So a world where also all of us are busy in our world, and we would have missed to look at, hey, I had a checkup done. I need to supposed to go to a doctor. I had a follow-up appointment. Get a reminder on your follow-up appointment. The appointment, if you just say in the message, right? Do you want me to schedule an appointment? Yes, I would. Yes, please go ahead and schedule, and it schedules it. And reminders of, we have now a lot of those glucose patches and all, right? Which constantly monitor your glucose.
Yes.
Give me a update on, hey, today you ate these things. I think it is working well for your insulin levels. Yeah. Not just showing me that, okay, how the monitor levels are changing, or saying that, hey, maintain this pattern. I think last 3 days your diet was good enough. So it would keep you sustain your glucose levels. So those kind of a word, I think I would like to be in probably 2030, where things are connected. There are a lot of scattered technology around. I think we just need to connect them, use it as a workflow. That's where I would like to see it.
Yeah, thank you. But I think there are some companies like Sugar trying to help with that glucose patch. Plus, they call you. what did you eat for breakfast? Why your sugar levels have gone up?
Yeah.
And they find out and they tell you exactly to control.
Yeah.
I mean, we have Sanjeev who has done PhD in that. So we'll talk about it probably after this session. Thank you, Vinaya. Harish, what would you add?
So 2030, right?
Yeah,
So another
2030.
4 years. So
Another 4 years from now.
See, all these years we have worked for so many MNCs, delivering products to the rest of the world, being in India and all of that. But 2030, what I would like to see is how we are able to deliver better care beyond these 5-6 metros that we see today in India.
Yes. Yeah.
Care even today is centralized: Delhi, Bombay, Calcutta, Chennai, Bangalore, Hyderabad.
Absolutely.
You go 100 kilometers beyond these places, people still struggle to, a pregnant woman still struggles to get 3 ultrasounds done in those 9 months.
Yeah.
I would like to see this changing, and changing at a much faster pace than what it is today.
Yeah, thank you. Yeah. I think we can relate to that. I think while we always talk about what's happening in the metros and the big cities like Bangalore.
Because we are technologists, we are fascinated by so many things that are happening right next to us.
Yeah,
and we are oblivious to what is happening 50 to 100 kilometers outside.
Elsewhere. We think what we see is what it is, which is not the case. I think bulk of the population doesn't get access.
No.
Thank you, Jessy.
I would dream of a place where we have more, again, accessible, affordable care across India, and preferably with hyper personalization of the language, the context, the patient background, and ability to be able to get the right data just in time, not get overwhelmed with the amount of information that would be flowing. So how do you have the right experience as a patient to be able to make decisions for yourself? How do you have the right experience as a physician to make the right decisions for the patients? So the right data at the right time, and having that experience where you feel empowered and equipped for your job and as a patient here.
What is one practical change healthcare organizations can make today that could noticeably improve patient or clinician experience within the next year?
That is, don't look at technology.
Yes.
Look at a problem that you're trying to solve and what is the impact that it is creating. And if you make that shift, then that will solve a lot of problems.
Yeah, thank you. Thanks. Next one. What is the biggest challenge in integrating newer healthcare technologies with existing or legacy systems and make people adopt it? So that is the next one.
I think one of the biggest challenges that we all face is the ability to unlearn. Right? If you want to learn something, the biggest strength that you should have is the ability to let go what you have, what has got you this far.
Yeah.
So that is, if you make that shift, then the adoption becomes a lot more seamless and easy.
Yeah. Again, not to do with technology.
Yeah.
But to do with people and practices.
Yes.
Anything else you want to add, Vinaya or Jessy?
Probably one example on the technology, right? I think the health records, digitization of health records, what again every industry is looking at, everybody is looking at. It's not new. I think Google Health Records existed around probably 2008 or from 2010.
Yeah.
But again, it was not so successful at that time because it caused additional burnout for the physicians, clinicians to record every single thing. You need to document health record, needs to have every single thing. It's more easy for you and me to converse. I mean, if I'm a doctor, I would like to spend more time with the patient rather than sitting and documenting everything, right? I think the piece again is about the adoption of technology. The technology exists to create documentation, thousands of pages you can create it. But if you are able to enable physicians to create that in minutes, I think that's the adoption. If along with Google Health Records, which now there are a lot of options to even record and convert into text and create those records. If that's the adoption piece where technology was individually seen and it was in fact creating burnouts for doctors to record so many things earlier. I think those are kind of the things that we need to look at, not just technology, look around the adoption.
Yeah.
how practical and realistic it is, and not just look at you're bringing a beautiful technology, but what if it is not solving the problem?
Yeah, sure. Thanks. Okay, cool. I think those were the questions from the audience, and I'll move on to rapid fire. I'll probably go through the whole list one by one. So I'll start with you, Jessy. There are 5 questions, and there are options, and you can choose. What matters more in healthcare transformation? Better technology or better adoption? We have discussed enough, but still for
Better
one last
adoption.
time. Better adoption. Thank you. One healthcare process that should be redesigned urgently.
What are the options?
No.
Yeah, I mean, I wouldn't say redesign. It is a solution that is there in design, but still not effective, which is connecting the systems. So while there are technology standards to say, hey, systems have to be interoperable, but we still don't have
Connected
systems that are
systems.
connected. Yeah.
Connected systems. Sure. Thank you. One thing technology teams should understand better about clinicians.
That they do have a lot of burnout.
Thank you. One thing healthcare leaders should understand better about software and systems.
At the end of the day, there is some rate of error, and you have to plan for how do you build resilience in software. So the software resilience is more important.
Sure. Thank you. One word that should define the next decade of healthcare.
Transformative.
Thank you. So, same questions, Harish. What matters more in healthcare transformation? Better technology or better adoption?
Definitely adoption.
One healthcare process that should be redesigned urgently.
Customer intimacy.
One thing technology teams should understand better about clinicians.
Better about clinicians, like I said earlier, they wait and watch. Not to say that they are laggards in adoption of technology, but trust is very important for them before they adopt the technology. So your solution should be trustworthy for him or her to believe that this is going to add value.
Sure. One thing healthcare leaders should understand better about software and systems. I mean to say care delivery teams.
Yeah, so one thing is everything that we do has to be scalable, right? So we cannot solve a problem within limited boundaries. So any problem that we solve should be scalable, for a much larger audience.
One word that should define the next decade of healthcare.
Digital.
Thank you. Same set of questions, Vinaya. What matters more in healthcare transformation, better technology or better adoption?
I think no doubt we all spoke about it. Better adoption.
I think we're reinforcing that.
Yeah.
One healthcare process that should be redesigned urgently.
I think we spoke about it also. Interoperability. I think
Connected systems.
we are done with carrying the physical paper records from one place to other. Connected systems and interoperability.
Yeah. One thing technology teams should understand better about clinicians, their perspectives.
I think use them first. Don't build your product and take it to them. Make them part of your journey. Understand the problem statement before you start designing a solution by yourself.
Sure. One thing healthcare leaders, as in hospital systems, should understand better about software and systems.
If you put yourself in a clinician's shoe and say that you have trust in the software you have built to let your loved ones to be operated on it or use it, I think that's the level of the work that needs to be done, and the industry needs to understand it. What we are building is not a pure software. We are building something where everybody's trust is on it. If you're able to allow your loved ones to go through it, then I think your job is well done.
Thank you. One word that should define the next decade of healthcare.
I think the speed and innovation needs to go hand in hand and reach out for the masses.
Thank you. So that brings us to the close of the event. What stands out from this conversation is that it's not about technology in isolation. It's about how people use technology, how they're all connected, and how systems support clinical flows, and how engineering quality builds trust, and how process and platforms ultimately serve patients and healthcare outcomes. Thank you, Vinaya, Harish, and Jessy, for sharing your valuable experience and your perspectives. I'm sure I enjoyed the conversation. I've learned a lot more today out of this interaction, and I'm sure audience would also benefit. Thanks to everyone who joined the call, who joined this fireside chat today. We hope this conversation leaves you with a clearer view of how process, technology, and leadership can come together to improve healthcare outcomes, patient outcomes. Thank you. Thanks, everyone, and have a wonderful evening.